Hello everyone. As we know that the COVID-19 cases are rising exponentially, so I decided to do a video so that it creates some awareness amongst the general people. So what is COVID-19? COVID-19 is coronavirus disease. It is a respiratory disease and most infected people will develop mild to moderate symptoms and recover without requiring special treatment. So the first thing that we need to do is stop panicking, right? Because the majority of the people will only develop mild to moderate symptoms and they can be recovered without special treatment. What are the common symptoms? As we know, fever, dry cough or difficulty breathing. They can also be tiredness, body aches, sore throat, and some extremely rare cases we can have diarrhea, nausea or a runny nose. What to do? Now that we know the symptoms, what can we do is the person with mild symptoms who are otherwise healthy, they need to self-isolate themselves. What else that they can do is they can call on the toll-free numbers that the government has made and they can ask for advice on testing, right? The people who have fever, cough or difficulty breathing are the ones that need the medical attention. Also, if you have history of travel, right? Travel history, or if you have a contact history, if you have been in contact with a person who has travel history, you need testing, right? Now we know if we have symptoms what to do, right? But now ऐसा क्या करें कि हमें हो ही ना ये symptom, ये हमें आए ही ना, right? As we know that prevention is better than cure, how can we prevent it? Firstly, wash your hands regularly with soap and water or alcohol based sanitizer, or with normal water for that matter, right? You need to wash your hands regularly. What washing your hands will do, it will wash off the virus that in case if it is sticking to your hands. When to wash your hands? If you are cooking meal for somebody, if you have touched any infected surface, if you have touched a currency note, you need to wash your hands, right? वैसे भी practice hand washing, practice hand hygiene. Wash your hands often. Now how to wash your hands? Open the tap, put your hand under the normal running water, take ample amount of soap, close the tap, wash your hands. The mnemonic for this is Suman Kumari, right? Suman K. You need to wash both the palms, the back of your hand, in between the fingers, the back of your nails, the thumb area, the tip of your fingers, the wrist, and then rinse it off, right? What does Suman Kumari stands for? Suman K is Seedha, that is your palm, Ulta, that is your back of your hands, A is for Anguta, M is for Mutti, N is for nails, and K is for Kalai. Suman K, right? So these are the basic steps for hand wash. Next thing is you need to maintain social distancing, and this is really important, friends. Why is it important? You'll get to know. See, if this person A is infected, this person A is infected and this person B is not infected, but this person B can avoid getting infected. Why? Because she has maintained proper gap from the infected person, so that when this person speaks or coughs or sneezes, when he's ejaculated the viruses in the environment, these viruses, these fail to reach her. Why? Because she has maintained her gap. And that is why social distancing is important. That is why we are telling you to stay indoors, right? That is why we are telling you to avoid close contacts with people. Avoid touching nose, eyes or mouth. Why? Because from these areas the virus can gain entry into your body. The hands are really busy. If you touch your eyes, nose or mouth, the virus can enter your body and cause infections. Next is maintain respiratory hygiene. Like, basic thing is you need to maintain your coughing hygiene. You need to have coughing etiquette. what you can do is, when you cough or sneeze, you need to cover your mouth by a tissue or a handkerchief, and after that dispose of the tissue paper properly and wash your handkerchief. Or you can sneeze or cough in between the elbow. Why not hands? Because if you infect your hand and if you after that you touch your eyes, nose or mouth, the virus can gain entry. Or if you're already infected and if you have used your hands, what you can do is, if you touch any surface, you can transmit the virus to that area. So it's better to sneeze in between your elbow and after that wash your hands. What else can we do in normal life? We can avoid touching the door handles, because majority of the people are touching it, so it is infected. So we need to avoid touching the handles. We need to properly clean the handles and other accessible areas. The other things that we use, the majority of people are using, like the switchboards, the sides of the curtains, right? The door handles for that matter, your mobile phones, you need to disinfect it. Just take small bit of sanitizer on a cotton ball and you can sanitize your phones also, right? Or frequent hand washings to hain. So the first thing is to avoid touching the handles, avoid handshakes, and practice namaste. As we can see, it is not the handshake of person A or person B, it is the handshake that is done between the viruses, right? The virus from the infected person is reaching the uninfected person. What else we can do is, we need to put on the mask, right? Not everybody requires a mask. It prevents the entry of the organism, that is for sure. But this person here, this gentleman who is infected, he is wearing the mask for the safety of others, right? So like when he sneezes, it does not inoculate the particles, the viruses in the environment. So we need to put on the mask while sneezing, coughing or speaking. What we don't need to do is, we don't need to remove the mask and then cough or sneeze or speak. We don't need to remove or wear the mask using the outer surface. We need to do it by using the sides of the surface. Why? Because it is the outer surface that is mostly contaminated. So we don't need to touch the outer surface. Instead, we are using the side threads. Like I said, don't use the door handles. What instead you can do is, you can push it using your elbow or the arm. In case you are living in a building and you need to use the lift, what you can do is, you can avoid using your fingers and you can use your elbow. Why? Because it's practically impossible to touch your face with your elbow, right? And if your hands are really busy, if you are using your hands more often, the viruses are sticked to your hands, and when you touch your face, the viruses can gain entry into your body. So the thing is, avoid using your hands and practice hand hygiene, practice respiratory hygiene, maintain social distancing. The first thing that you need to do is stop panicking. You need to stay safe, stay indoors, stay informed, right? We will fight this together. Thank you very much.